My guest today is Haley Landherr. She is Director of Business Operations and the Chief of Staff for UnitedHealthcare Dental. Ms. Landherr, good to have you with us.
Thank you so much, Tom. Glad to be here.
You know, and my mother was always a fanatic about going to the dentist and taking care of our teeth when we were little. This goes back quite a number of years, but maybe stress for us or explain for us the importance of oral health. It's improved a lot in the United States in past decades, and maybe people take it too much for granted.
Absolutely, definitely. Your mother is right, as most mothers are. Your smile is not just how people see you. It's not just a visual thing, right? It is a connection to your overall health. There is a pretty important connection, actually, to your dental health, your gum health, and then to your overall health. It's how your body helps to protect itself against illness. Plays a significant role in your overall well-being, especially for people with chronic conditions. There's studies that show that bacteria and inflammation within your mouth can be associated with gum disease, and it can be linked to cardiovascular disease, osteoporosis, and diabetes. Gum disease appears to be more frequent and severe among people who do have diabetes, and there's research that shows that people with gum disease have a harder time controlling their blood sugar levels, and that regular periodontal care can help to improve diabetes care management. So, with your United Healthcare FedVip dental plan, there's coverage for our members that has benefits that are specifically designed with this in mind. So, if you're managing one or more of these conditions like diabetes, rheumatoid arthritis, COPD, asthma, or if you happen to be pregnant, you're eligible for enhanced coverage that will help you get additional cleanings or different periodontal maintenance. And both of our plans that we offer through FedVip today cover that. So I'll give you a really good example of what that looks like for myself. I just had twins earlier this year in March, and that was one of the first things that my dentist shared with me is that my teeth and my gum health is going to have an even more an important impact on my overall health. So extra cleanings and extra care, making sure I was flossing and brushing and using my water pick became really important. Like we talked about, it has an impact on your overall health. And what is so nice about this enhanced coverage is that it gives you some peace of mind, right? Members can focus on other parts of their pregnancy journey, as an example, and not have to worry about unexpected out of pocket costs when it comes to dental care.
All right. And by the way, how's the teething coming along on those twins?
We're getting into it. We are for sure getting into it. They're just about 6 months now and chewing on everything, including each other.
All right. So you're drowning in drool, but you're making sure they're going to grow up with good periodontal health. Terrific.
Lots of bibs, yes.
Which leads to the question of how dental and periodontal and oral health care must change with different stages of life. When you're a child, it's one thing, middle age and elderly, it does vary, doesn't it?
It absolutely does. Yes, your oral health is really important through all the stages of your life. So, starting early, like for my children, my babies, is really important. There's recommendations that are part of dental health guidelines from the American Dental Association, or what I'll refer to as the ADA, for babies and children as a starting point, right? So, during infancy, making sure that you're cleaning your baby's gums with a wet washcloth or maybe a child sized toothbrush, nothing too bristly, nothing too harsh. When they start to get teeth, maybe around age 2, when they've got a little more than just one or two, right? You can start to brush your baby's teeth with a soft bristled toothbrush and a tiny, tiny smear of toothpaste, just making sure that the toddler spits out the toothpaste when you're done brushing their teeth. When they start to get back teeth, this can be a family event, right? When they start to get back teeth, you can all floss together, making sure they're flossing right behind those back molars. And then something else that's important too is trying to avoid putting your baby to bed with liquids like a bottle of milk or formula or juice. The sugar in those can cause some tooth decay, which can lead to problems with oral health down the road. So as you get older, it's important to keep your hygiene up and maintaining your oral health hygiene throughout your life. There's some recommendations again by the ADA for adults and for children that include brushing your teeth regularly and your tongue, not just your teeth, brushing your tongue as well for up to 2 minutes after meals and before bedtime. You can also rinse for 30 seconds with mouthwash. It can help to kill bacteria and clean parts of your mouth that brushing might miss. The other thing that you can do is floss daily and consider using a water flosser. It can help to get into some spots where maybe it's harder to get your hands all the way in your mouth to floss, right? The water flosser can push some water to some of those hard to reach places.
Got it. All right. So then maybe when you go to the dentist, you won't have so much, what do they call it? Scraping away there, the
Yes,
filler.
absolutely. Save yourself a little bit of time, a little bit of pain, and you don't have to lie to the dentist if you do it, right? And saying how often you actually floss, you get to tell the truth, which earns you some good brownie points.
Right. And they can see what's been going on anyway. You can't make up for
It's
it in
hard to lie.
that dentist visit. And the dental industry itself has evolved a great deal. Maybe describe what some of the evolutions have been and some of the innovations UnitedHealthcare has done to foster this good tooth and oral health development.
Absolutely. So, one of the things that we've made available and that you're probably starting to see in the news or read a little bit more about is virtual care for dental health, which, when you first hear virtual care for dental health, what a concept, right? Kind of hard to visualize what that looks like. The way I think about it is almost like a triage situation. Sometimes dealing with an unexpected medical problem or dental problem where you have some pain in your mouth, you might try and get in to see a dentist. It's hard to see the dentist, they don't have availability. Your dental problems probably don't happen at the most convenient times, right? When you start to feel pain, it could be at night or later in the evening. Um, Now, available to members, dental plans can start those conversations or start really that triage process with a virtual phone or video meeting where they can get advice from a licensed dentist on where to go with their pain. A lot of these folks end up in the ER unnecessarily. If we can maybe get ahead of the issue or ahead of the pain through these virtual teledentistry visits, that member can be put or advised to go into the right set of care, get connected with a network dentist, find the next step instead of having to go to the emergency room to treat that care.
And there's also some technological developments in the basic issue of brushing itself.
Absolutely. There's some new technology in toothbrushes for adults and for kids. Back in my day, it was the fun toothbrushes that sang or made sounds that had some of your popular singers that would play over the toothbrush while you were brushing for the 2 minutes of time that we talked about, right? One of the companies that we partner with is Quip, and Quip has a smart electric toothbrush, and it's shown to be effective in removing plaque and gingivitis. And a couple of the cool features it has is one, that 2 minute timer so that you know you're brushing for the entire duration that you're supposed to be brushing for. It even has a little pulse at 30 seconds within those 30-second increments. So you know you should be moving around at that time and making sure you're hitting the entirety of your mouth. The other thing that it has is built-in sensors to track your brushing performance. So you can see your duration, are you covering your entire mouth, and are you using the right level of intensity? What's really cool is that eligible members who are enrolled in a FedVIP plan through United Healthcare Dental have access to a discount on those toothbrushes. So we offer 30% on the Quip Smart Electric Toothbrush and other oral care products and bundles, which include refillable floss and mouthwash. And you can get more information about that at the FedVip Benefit Hub.
And by the way, those toothbrushes, are they battery operated and you can change the battery or do they recharge or how does that work?
Most are rechargeable, yes.
All right. And then let's talk about dental costs because that's a big fear item for a lot of people. I mean, I remember when I had my first noble metal crown, it cost more than my first Pontiac. So, it can be expensive to go to the dentist. And what
Absolutely.
can help foster transparency, predictability, and helping people understand the costs?
Sure. So the technological advances that we're offering or that we're looking into aren't just for the consumer. For the network providers that we have that help to serve our members, we offer some pretty cool tools that they can self-serve and access on their fingertips right online at uhcdental.com, one of those being the treatment plan calculator. So as a network provider, you log into uhcdental.com, you can pull up the member that you're going to have in your chair, either while they're right there in your office or before they come in to receive their care, and you can build different treatment plans that show what the consumer might need. If they're going to need a root canal, what other kind of treatment options they might have. You can build out all those different scenarios based on that member's actual benefits, and then show them while they're there in your office what their out-of-pocket costs should be. They might have an option one, an option two, an option three, depending on the severity of what they have going on, or maybe they've got a little bit of time to consider, right? So they can know right there while they're in the office with the dentist that they're working with what their out of pocket cost could be.
And you mentioned root canal, which for many centuries has been the reference point for something horrible. But the reality is that the technology there, the treatment options in root canals and dentistry in general have come light years from the days when it used to be something to dread. Fair to say?
Definitely, right. Lots of improvements in how consumers can be treated for their dental problems, including for root canals.
All right. So you've convinced us. Where should people go for more information at this point?
Absolutely. For more information and resources, which there are a ton out there, you can visit uhcfeds.com. At that site, you can learn more about the benefits we offer to federal employees and their families and the support that you can get for your oral health needs. We also have additional supporting materials out there, including webinars, resources to help you access care, and to help better understand your benefits. There are some details outside of dental insurance as well that you can read within that website, things about critical illness, as an example, what your allowance might be there, and if you get any member discounts on state of the art hearing aids.
All right. Some advice we can really sink our teeth into. Haley Landherr is the Director of Business Operations and the Chief of Staff for UnitedHealthcare Dental. Thanks so much for being with us.
Thanks so much for having me, Tom.
And I'm Tom Temin of Federal News Networks. You're watching Federal News Network. Let's go back to the studio now for more on the open season exchange.